And so you mentioned screening. How do you get screened for kidney disease?
So I think it's important that we all do see our primary care providers for the routine checks, blood pressure. I can't tell you how many times I've seen people and I said, well, how long has your blood pressure been high? And no one's checked their blood pressure for 4 or 5 years. So making sure that we have the routine physical examinations, blood pressure checks, cholesterol checks, but also having blood tests so that we're actually getting the test that we look at how well the kidneys are actually filtering the toxin. So as you may know, we look at the creatinine that's used in a formula, and it gives us the estimated kidney function percentage. And then the other important thing is the urine test, right? One of the first signs of, for example, diabetics getting involvement of their kidneys because of the diabetes is that they start to leak protein in the urine. And that's checked with a simple urine test done in the morning. Small urine sample, doesn't have to be a 24-hour collection, and we can check for protein leakage. And of course, if we see blood in the urine, microscopic blood, then we need to screen for other causes of kidney impairment, such as the immune-related ones that I mentioned.
And so is there a certain age we should get screened at? Like, is this for anybody seeing their family doctor they should be asking about?
Very good question. I think if you have a family history of kidney disease, then I think that we should be getting checked as early as possible. So even if you're, 20 years old or 15 years old, you should be getting checked, blood pressure checks, if there is a history of family history, genetic component. But I think that if that's not the case, then definitely after the age of 30, people should be getting screened with the usual things that we do. And for example, with a condition called polycystic kidney disease, when we do ultrasound screening to see if that is something that's been passed down, then at 30, we recommend that people should be screened with ultrasounds.
So we've heard about the eGFR test. Can you tell us how that helps, how that works and how that determines kidney function?
To get an estimation of the percentage of kidney function, the easiest way that we can do this is we do a blood test and we get a value called the creatinine. We check the creatinine. Creatinine is actually not a toxin. It comes from our muscles. So people who are more muscular will naturally have a higher level of creatinine in their blood versus someone who's less muscular. But what's interesting is that the creatinine gets cleared by the kidneys, just like other toxins that are very difficult to measure. Creatinine is not a toxin, but it's a surrogate for us. It's a way for us to check, and if it's not being cleared, then it starts to rise in the blood. So we check the value, and if it's increasing, it tells us the kidney is not filtering as well, and therefore other things are not being cleared, the actual toxins. And so we use that, and in order to get a percentage, we use a mathematical formula, which uses the person's age and their sex, and we put that into the formula, and then it gives us an estimated filtration rate. The glomeruli are the little factories or the little units in the kidney that are actually doing the filtering. But that's what the E stands for, Teresa. That's the estimated filtration rate. And just to let you know that with advances in other ways that we can check, we're able to now use something called cystatin C. That's a little bit actually even more accurate than using creatinine, but it's not widely available. But hopefully with time, it will become more available in all the laboratories, because creatinine obviously is going to be affected by your muscle mass, whereas a cystatin is not so much.
So what steps can a patient take if they've been told that they need to manage their kidney health? What things can they do?
So I think making sure that you do your regular visits with your doctor, and making sure those things that we've mentioned are checked, making sure that you do know what your blood pressure is. Many people don't know, they've been to see their doctor, but they don't actually know. And if you do have any history of even mild high blood pressure, it's important to take ownership and get a machine and check it and be on top of it to make sure that it's not staying high and that it's being addressed. Making sure that, we do screen for anything else like the diabetes, etc. Making sure that you have a healthy lifestyle. We all know that for taking care of our hearts and taking care of other things, but it's equally important for the kidney to make sure that we have a good diet, make sure that it's kidney friendly, so not excessive amounts of salt, not excessive amounts of animal proteins, making sure that it's a balanced diet and making sure that we get proper exercise. Definitely sedentary lifestyles and having a higher body mass can definitely increase the risks of various different medical issues, including kidney disease. So it's really important. It doesn't have to be majorly strenuous, high intensity, as long as it's a regular 20, 30 minutes of even walking a day, every day, it's helpful. So those are the main things I think that we all should be doing.